So the next three lectures are going to be assorted diseases from the rest of the chapters in the textbook. So we're going to start with one of my all-time favorites, acne vulgaris. It's an all follicle associated disease. A mass of sebum and dead cells are actually trapped within the follicles or the pores associated with the hair follicles. A comedo is a skin swelling over the pore leading out of the hair follicle. A white head is a comedo with a closed pore and actually will usually accumulate pus, where a black head is a comedo with a pore open to the surface of the skin and will just simply have the sebum and dead cells. Other types of lesions seen with acne vulgaris are pustules or papules, and these are lesions that have erupted onto the surface of the skin. Cysts are pustules that come to involve deeper layers and even the subcutaneous part of the skin. Cystic acne, such as seen here in this picture, actually is going to be a widespread cyst involving quite a bit of different tissues. And 85% of us will suffer from this skin condition sometimes during our lifetime. The primary causative agent of acne vulgaris is Propionibacterium acnes, and this is found actually on the surface of the skin. The highest rates of acne vulgaris are actually seen in industrialized countries. Impetigo. This is a superficial bacterial infection that causes the skin to flake or peel off. It's caused either by Staphylococcus aureus or Streptococcus pyogenes, or mixture actually of the two. Children are the primary victims of impetigo. Symptoms are the same regardless of the organism that causes the infection. And this just shows a picture of impetigo, and this is a common area around the mouth and the nose. But this is actually an older individual where we can actually see these lesions on the back of the neck. If it's caused by Staph aureus, and of course we know staph will cause many types of infection, and that they're gram-positive cocci, they are metabolically versatile. That's why they can actually grow in lots of different places. They produce exfoliate toxins A and B, coagulase, which breaks down collagen, hyaluronidase, staphylokinase, DNase, and lipases. Strep pyogenes also causes strep throat, scarlet fever, puerperal fever, which is very common in postpartum women, necrotizing fasciitis, known as the flesh-eating bacteria, bloodstream systemic infections, and rheumatic fever. And again, it's a gram-positive cocci. And the ones that we see most problems with are the beta hemolytic streps. They actually produce adhesive elements called LTA, M protein, and hyaluronic acid capsules. They produce this hyaluronidase that will actually break down the capsule and cause then the infection to occur. So this is the table in chapter 18 of impetigo caused by either staph or strep. Again, most often they're seen in children. Staph is often seen in older children and adults by itself, and strep by itself is most often seen in neonates. Now, staphylococcal scalded skin syndrome. This is a dermolytic condition caused by Staphylococcus aureus, and it develops predominantly in neonates and those under the age of 1. It is a systemic form, really, of impetigo. Phage-encoded exfoliate toxins are responsible for the symptoms, and literally the skin just sloughs. Bullous lesions are caused by exfoliate toxins A and B and have the appearance of wrinkled tissue paper on the surface of the skin. This leads to widespread desquamation of the skin, in other words, sloughing of the outer layers of the skin. Patients are left vulnerable to secondary bacterial infection because we're losing part of that physical barrier. And this is what it literally looks like. So it looks like almost third-degree burns from being being scalded in hot water. And this is what actually happens is these exfoliate toxins actually break down cellular adhesion or cellular connections and cause these fluid-filled blister-like structures that just simply cause the outer layer of the skin to slough off. So here's the information out of chapter 18 about staphylococcal scalded skin syndrome. Now, gas gangrene is also called clostridial myonecrosis, and this is actually caused by the organism Clostridium perfringens. Endospores of Clostridium perfringens can be found in the soil and even on the surface of the human skin, in the intestinal tract, and the vagina. But typically they don't cause any problems. They do require anaerobic conditions to manufacture and release endotoxins. They actually cause then an anaerobic cellulitis that typically tends to remain fairly localized. True myonecrosis, however, spreads beyond the localized area into the healthy tissues. And gas gangrene actually causes such bad damage sometimes that we have to actually amputate limbs. The exotoxins produced by C. perfringens include the alpha toxin that can lead to rupture of the red blood cells, edema, and tissue damage. And if you notice here in this radiograph, you'll see these dark areas within the subcutaneous tissues, and those little dark areas are actually gas that has been produced by the metabolism of Clostridium perfringens. Another exotoxin is collagenase that breaks down collagen, hyaluronidase, and even DNase. And this is actually large pockets of this gaseous substance and then smaller lesions with the gas of gas gangrene. So most often common mode of transmission is actually from soil containing the endospores. And this creates a very nice deep wound usually because it's usually from being stuck with something that was in the soil, similar to tetanus. And this can actually then create that anaerobic environment. The best treatment really is surgical removal of the dead and dying tissue, clindamycin with penicillin, and a new thing has actually been hyperbaric therapy to try to prevent the gas gangrene from growing. Two diseases that present as general rashes all over the body in which individual lesions contain fluid is vesicular or pustular rashes. And these are actually known sometimes as pox lesions. And the two big ones are chicken pox and smallpox. Chicken pox, in most individuals, chicken pox is a relatively mild disease. Most cases of chicken pox resolve in 2 to 3 weeks. Some will experience secondary infections from the excoriation of the lesions, meaning that they scratch and break them open, and then cause secondary bacterial infections. Chickenpox carries a 20% mortality rate in immune-compromised individuals, and about 0.1% of all cases are followed actually by an encephalopathy, a swelling of the brain. Chickenpox vaccine has been available for a number of years, and for infants from 12 to 15 months is usually when you get your first one, and then a follow-up booster somewhere between 4 to 6 years of age. Chickenpox is caused by the human herpes virus 3, better known as the herpes varicella zoster, and it is actually the varicella portion that causes chickenpox. And this is what it looks like. And you can actually have these little lesions that are very, very itchy and fluid filled all over the body. Now, shingles is thought to now be a reactivation of the human herpes virus number 3 after a chicken pox infection, and this can be years afterwards. The virus goes into a latency stage in the ganglion of the thoracic and trigeminal nerves. Shingles will present with asymmetrical lesions on the trunk or head, and they typically tend to see outbreaks along one of the dermatomes. I'll explain that in a moment. This oftentimes develops after psychological stress, any type of radiation treatment, immunosuppressive drugs, surgery, or even just having cancer itself. An attenuated vaccine is now recommended for adults. And this is primarily reactivation of the zoster part of the human varicella zoster. So what we'll see are the bullous lesions actually breaking out on one side of the body, again along maybe one or two or three adjacent dermatomes. And if you remember from your anatomy, the dermatomes are the areas of the body that are actually controlled by each of the spinal nerves. And so because the shingles virus tends to accumulate in the ganglia of the thoracic nerves, so we see a lot of the shingles outbreak along here, and the trigeminal, which would be up in the facial region. That's why we typically see these. However, we can see outbreaks of shingles actually on the limbs and even bilaterally sometimes. Smallpox, naturally occurring smallpox, has been considered eradicated worldwide due to our vaccination protocol. We did have for quite a while a number of small cases in localized areas of the world that would pop up, and we would go in and vaccinate everybody at that point. Smallpox has not completely been eliminated, as smallpox virus is actually still contained within some of the biohazard level 4 laboratories around the world. So it is still considered a biological terror threat. The progression of the rash can be macular, papular, vesicular, and finally pustular, and this is simply size and what type of fluid is found. And typically the pox lesions will leave serious scar tissue behind. So here's a little girl covered with these pox lesions, and if she survives, all of those will actually be scarred in. There are two forms of smallpox. Variola major, which by the way is another name for smallpox. It's actually caused by the variola virus. But variola major is highly virulent. It leads oftentimes to toxemia, shock, and intravascular coagulation. And so this is actually the more deadly form of smallpox. Variola minor, the rash is less dense, and typically patients experience much weaker symptoms, and death is not as high with the variola minor. So this table out of chapter 18 just simply compares chickenpox and smallpox. Measles. Measles will actually kill 430 children every day around the world. And even though we have a very effective vaccine in the MMR vaccine, this vaccine is not as available, especially in third world countries. The effective vaccine has actually been available since 1963. I actually, since I was born before 1963 by a couple of years, I never actually received the measles, mumps, rubella vaccine. So I actually have had the measles, and let me tell you, it wasn't fun. Before the vaccine was introduced, measles killed 6 million people per year, and most of those were children. Approximately 85% of children around the world have received the vaccine, and this was out of a study done in 2010. However, most of that percentage are in industrialized countries. Two primary forms of measles. The rubella, which is also known as German or three-day measles, is caused by the rubella virus in the Togaviridae family. Measles, known as the 10-day measles because they typically tend to last that long, is caused by the rubeola virus that's found in the Paramyxoviridae family. So when we say measles, we really need to know, are we talking about rubella, which typically has a shorter duration, or actual measles caused by rubeola that tends to last longer? From a clinical standpoint, it's actually difficult to differentiate between these two, and I was fortunate enough to have actually both forms in childhood. Both are contained in that measles, mumps, and rubella vaccine. So you get these vesicular lesions and you get them all over the body. They can itch. Both forms of measles can cause systemic high fevers and of course can result in death. Scarlet fever is a result of a respiratory infection with Streptococcus pyogenes, the same one that causes strep throat. If the strain carries a bacteriophage carrying the gene for the erythrogenic toxin, scarlet fever can result. So, if there's a bacteriophage that actually has infected the Streptococcus pyogen and has inserted a gene for this erythrogenic toxin, then we can see scarlet fever resulting from a strep infection. And how to spot scarlet fever is typically we have a very fine red rash that feels almost like sandpaper on the surface of the skin. And you can kind of see that here on this child's cheeks. A white coating on the tongue that peels after a few days, leaving the tongue swollen and almost looking like the surface of a strawberry. And you can kind of see this strawberry-like tongue right here. Fevers over 101, flushed red face but typically pale around the mouth, and oftentimes the cervical lymph nodes will be swollen quite a bit in the neck region. Now, warts, papillomas, and all warts are caused by papillomaviruses. And a wart is a wart is a wart, no matter what type it is. They're all caused by papillomaviruses. They develop in nearly all individuals, but actually children are more likely than adults to develop some form of warts. Seed warts are usually painless, elevated rough growths on the finger or other body parts, and oftentimes can easily be frozen in order to be gotten rid of. Plantar warts, usually found on the surface of the foot, hence the name, usually are deep, painful papillomas and oftentimes actually have to be surgically removed. Flat warts are smooth, skin-colored lesions that develop pretty much anywhere on the body, but tend to be clustered on the face, the trunk, especially anterior trunk, the elbows, and the knees. So human papillomavirus is the most common wart etiological agent, and this can be passed by direct contact, auto-inoculation, or indirect contact. Home treatments or cryosurgery, and by the way, with cryosurgery, usually the virus is not eliminated, so we can actually have them come back. I will mention Musculum contagiosum virus, which also causes oftentimes these flat-like wart structures, and they are actually within the same family. Now, large pustular skin lesions. There are several diseases that we need to talk about here, and leishmaniasis is one of those. This is caused by the protozoan Leishmania donovi. This is actually a tropical parasite. The zoonosis is actually, or zoonotic disease is transmitted by the female of a group of flies known as the sand flies, and they bite to take a blood meal. Cutaneous leishmaniasis is usually localized infection by the parasite in the capillaries of the skin. It's found across the Mediterranean, African, and Indian regions, and even in South America. And primarily, Central and Northern South America is where we'll see this because that is the region of the vector of the sandfly. Mucocutaneous leishmaniasis affects both the skin and the mucous membranes. So we may actually have capillaries in the nose and or mouth that may be affected. And the mucocutaneous is primarily limited to areas in Central and South America, but we can see both forms in Central and South America. Now, cutaneous anthrax. Bacillus anthracis causes three forms of anthrax. The least harmful is the cutaneous form. We also will see the respiratory, which tends to be the most deadly, and a GI form, which is the least common of the anthrax diseases. In cutaneous anthrax, the bacillus actually causes a black eschar, which is just this kind of black necrotic lesion where the endospores enter the skin and actually begin to grow. And in the fall of 2001, if you remember, there were 11 cases of inhalation anthrax through the terrorist attacks that actually resulted in death. In inhalation anthrax, 20% mortality is actually seen if left untreated. Cutaneous anthrax can be treated topically and typically is not fatal. So this just compares leishmaniasis out of chapter 18 and cutaneous anthrax. Now, ringworm is cutaneous mycosis. These are fungal infections, and the ones that affect the skin, hair, and nails we oftentimes refer to as dermatophytes, or another name that's used oftentimes are the tinea infections. If the ringworm is found on the scalp, it is known as tinea capitis. If it's found actually in the coarse hair of the beard, it's known as tinea barbae. If it's found anywhere else on the body other than the scalp, it's known as tinea corporis, and corpora simply means body. If it's found specifically in the groin, it's known as tinea crucis. Found on the foot, it's tinea pedis. And if it's actually found in the nail beds and nail plate, then we actually call this tinea unguium. Conjunctivitis. A relatively common infection is conjunctivitis. Bacterial infections of the conjunctiva tend to produce milky discharges because it's actually producing pus. Viral infections tend to be more clear exudate from the eye, and allergic responses causing conjunctivitis usually again have copious amounts of clear fluid. We often will see redness and swelling of the eyelid, and we can even see redness or injection of the sclera just because of the irritation from the conjunctiva itself. Sometimes conjunctivitis will cause photophobia, where the patient simply does not like to be in bright light. Several causes of conjunctivitis in this table out of chapter 18. With neonatal conjunctivitis, the most common ones we see are chlamydia trachomatis and Neisseria gonorrhoeae. So two of our sexually transmitted diseases. And these these organisms would be found in the vaginal canal and will actually be injected or come in contact with the neonate's eyes as they pass through the birth canal. Bacterial conjunctivitis, staph, strep, Haemophilus, Moraxilla, chlamydia, and Neisseria also would be in here because they are actually bacteria themselves. And viral conjunctivitis, primarily the adenoviruses, but there are some other viruses, including some coronaviruses, that can cause conjunctivitis. Now, a trachoma is actually caused by Chlamydia trachomatis, and this is chronic infection of the conjunctiva of the eye. And this is a major cause of blindness around the world. Several million cases are seen every year in Africa, Asia, the Middle East, Latin America, and even some of the Pacific Islands. Ongoing or recurrent infection leads to chronic inflammatory damage and scarring, and this can eventually then infect the cornea, causing corneal scarring. And this is what it looks like, and you can see the blistering effect here on the conjunctiva, and that will actually then sometimes excoriate the surface of the cornea, and then we get the infection in the cornea itself. So trachomas are caused by Chlamydia trachomatis. It's usually indirect contact or mechanical vector that will actually cause these. Azithromycin or topical erythromycin are primarily the two drugs that we use to treat it. Prevalence is as high as 60% in those areas, especially tropical regions where this is endemic. So summing up, these are the major microorganisms causing disease of the skin or eye. And these pages may not be perfect in your new text because this may actually be from another edition, but it will be close to these pages. And most all of these will be found in chapter 18. And this is continuing with the fungi, the protozoan, and the helminths. And I didn't mention the helminths, but Onchocerca volvulus, in combination with a bacterium called Wolbachia, actually causes river blindness. We won't really talk about that since we don't see that in the United States. Okay, meningitis, inflammation of the meninges around the brain and or spinal cord. The anatomical syndrome, different microbes cause meningitis and produce similar constellation of syndromes because they all are infecting the meninges. Non-infectious causes of meningitis also exist. Serious forms of acute meningitis are caused primarily by bacterial species. Entrance into the central nervous system are facilitated by or co-infection with a lot of our respiratory viruses. So if we have a suspicion of meningitis in our patient, one of the easiest ways to confirm that is to do a lumbar puncture to obtain cerebral spinal fluid. We can gram stain that cerebral spinal fluid for bacterial organisms. We can culture it. And oftentimes, if we actually see bacteria with a gram stain, we'll begin treatment with broad-spectrum antibiotics with a shift in treatment after a definitive diagnosis has been confirmed through culture. The reason for this is because of the possibility of this infection spreading into the nervous tissue. Signs and symptoms will typically include photophobia, headaches, painful or stiff neck, systemic fever, and certainly we'll see an increase in the white blood cell number in the cerebral spinal fluid as the body mounts an attack. Certain organisms may cause characteristic symptoms. Neisseria meningitidis. This is a gram-negative diploid or diplococcus, and you can actually see the diplococcus here at the ends of these arrows. And these are actually contained within the neutrophil. This is also known as meningiococcus. It is associated with an epidemic form of meningitis, and Neisseria meningitidis causes one of the most severe forms of meningitis. It's responsible for almost 1/4 of all meningitis cases in humans. The polysaccharide capsule of Neisseria actually protects it against phagocytosis. So it's actually somewhat unique that we see them here in the neutrophil because they have been phagocytized. But also their capsule may prevent them from actually being digested once they are in the neutrophil or macrophage. Neisseria actually produces an endotoxin that acts as a potent white blood cell stimulator. And this will actually cause many white blood cells to be going through diapedesis in nearby capillaries. And this can actually cause small bleeding areas called petechia. Meningococcemia is rare but does carry a very high mortality rate. And this simply means we've moved from the meninges into the bloodstream, and now we can go anywhere. Neisseria can cause sporadic or epidemic incidences, and most oftentimes we see Neisseria meningitis late in the winter and in the early spring. Transmission occurs when carriers live in close quarters, such as within family units, daycare facilities, college dorms, military barracks, and even nursing homes and prisons. Immunization for Neisseria meningitis begins at around age 11, and boosters will be needed. This is actually showing a systemic form of this, and this is causing these petechial hemorrhages. This one's actually fairly large, and we would actually refer to that as probably ecchymosis, and it's just simply the fact that it's a larger bleed area. Streptococcus pneumoniae will actually cause, or is referred to oftentimes as pneumococcus, and it is the majority of bacterial pneumonias. However, it is often frequently associated with community-acquired meningitis. It does not cause petechia like the Neisseria do, and it's most likely to occur in patients with underlying susceptibilities, so those that, for say, are immune compromised. Carriage rate actually exceeds 30% in some populations, meaning that those that are immune compromised may actually have almost a 3 times greater risk than those that are not. Streptococcus pneumoniae are small gram-positive flattened cocci that appear in end-to-end pairs or chains. They have a distinct appearance in the gram stain of cerebrospinal fluid. They too can produce that polysaccharide capsule that protects against phagocytosis. They are resistant to penicillin, cephalosporins, and the macrolide antibiotics. There are now 3 different vaccines that are available to prevent Streptococcus pneumoniae. Haemophilus influenzae is a gram-negative coccobacillus. And so you can actually, again, see the pairs, and then we have singlets as well. Haemophilus influenza, while it causes influenza-like disease, so respiratory disease, it actually causes one of the most severe forms of meningitis in humans. It is often called HIB because it is serotype B of the Haemophilus influenza that is the most common to cause meningitis. A vaccine has reduced asymptomatic carriage rates and has virtually eliminated HIB in the United States, but we still see it around the world. Listeria monocytogenes. This is a gram-positive flagellate, ranges in morphology from a coccobacillus to having very long filaments in almost a palisade formation. It does not produce capsules nor endospores. It usually has anywhere from 1 to 4 flagella. It's not a fastidious bacteria, but it is very resistant to cold, heat, salt, pH extremes, and even bile. It grows inside host cells and moves directly from an infected cell to an adjacent healthy cell. Listeriosis is typically mild in healthy adults, but causing meningitis and septicemia in those immunocompromised individuals. And so the elderly, anyone with an immune compromising disease, even fetuses in utero, and newborns. The Listeria bacterium can cross the placental barrier and actually cause premature abortion and fetal death. It oftentimes is most associated with contaminated dairy products, poultry, and meat. Listeria monocytogenes is typically shed in the stool of animals and then will contaminate products or their meat itself. Cryptococcus neoformans, which is an easy diagnosis. All you got to do with this guy is do a negative stain, and you will see the yeast along with a very thick capsule around the yeast body. This is a systemic fungus that causes more chronic meningitis with a gradual onset of symptoms, and this usually starts out as respiratory disease. In AIDS patients, however, Cryptococcus neoformans can have a very fast onset and acute disease and actually be fatal, causing meningitis. Cryptococcus neoformans is a widespread yeast in human habitats. It's spherical to oval in its shape with that large thick capsule around it, and it's transmitted primarily to humans in dried bird droppings, and primarily the species that we have the most trouble with are actually pigeons. And so cryptococcosis tends to be a more urban disease. Coccidioides immitis is another systemic fungus with again a distinct morphology. At 25 degrees Celsius, so at room temperature, Coccidioides grows a moist white to brown colony with abundant branching septate hyphae, so it grows mold. But at body temperature, it actually becomes a yeast. So Coccidioides is one of these dimorphic fungi, and it's at body temperature that it becomes a parasite. They typically will form small spherules of these yeast bodies, and this can infect several different tissues, including the respiratory tract, but this can actually cause a meningitis as well. So this is a true systemic fungal infection of very high virulence. Genetic susceptibility in individuals give rise to more serious diseases. It occurs endemically in natural reservoirs, and we're not really sure what the natural reservoirs are. But we do know that Coccidioides likes to be found in dry, arid soil. This is also sometimes known as valley fever, Rift Valley fever, or even San Joaquin Valley fever. And it's primarily seen in the southwestern United States. Again, Coccidioides typically tends to start out as a respiratory disease. So this is just showing its area of en endemic, uh, the endemic areas of Coccidioides. And so you can see here southern Arizona, San Joaquin Valley of California, but the Mojave Desert. So this whole area is pretty dry and arid and in its soil composition. Now, viral meningitis, there's a wide variety of viruses that can cause meningitis. Aseptic meningitis is viral meningitis that is assumed when a patient shows symptoms of meningitis, but no bacteria or fungi are found in the CSF. Viral meningitis account for the majority of meningitis seen in children. 90% of viral meningitis will be caused by enteroviruses. The herpes simplex 2, or the human herpes virus 2, is sometimes known to cause meningitis in both children and adults. HIV can also manifest as a meningitis as well. Generally, viral meningitis are milder than bacterial or fungal meningitis. And you can kind of appreciate here on the surface of the brain. We have some edema and we have some inflammation of the meninges going on here. But if this were bacterial in nature, we would typically also see a lot more inflammation and even pus. Viral meningitis usually resolves in the acute phase in less than 2 weeks, and the mortality rate of viral meningitis is actually less than 1%. So this table in chapter 19 just shows some of the causative agents of meningitis. So again, we talked about Neisseria, Streptococcus, Haemophilus, which are all bacterial causes. Listeria, which is another one, and then Cryptococcus and Coccidioides as being fungal causes of meningitis. And then again, several viruses can cause meningitis. Now, one of the types of bacterial meningitis that we see many times in the neonate and infant is caused by Streptococcus agalacticae. So another one of the Streptococcus bacteria. It is in the Lancefield group B Streptococcus, and it actually colonizes 1/10 to a third of all female genitalia or genital tracts. So it's often actually transmitted as the baby passes through the vaginal canal. And so it's one of the more frequent causes of neonatal meningitis. Typically, we can treat this with penicillin G, sometimes supplemented with an aminoglycoside to actually kill the Streptococcus agalactica and treat the meningitis. E. coli is also a potential causative agent for neonatal and infant meningitis. The K1 strain of E. coli uh, is the second most common cause of neonatal meningitis. Most often, this E. coli meningitis occurs in preemies, and unfortunately, the prognosis is fairly poor. Mortality rate runs about 20 to 25%. And in those that survive, oftentimes we get also associated encephalitis, and so we can see brain damage. Usually, again, E. coli will be transmitted at the time of birth. We also will see Listeria being one of the bacterial forms of infant and neonatal meningitis, and another more uncommon bacteria, Coronobacter, that actually can cause this as well. Now, meningoencephalitis. Encephalitis is inflammation of the brain. Encephalitis can occur without meningitis. Meningitis can occur without encephalitis. But many times with meningitis, the bacteria or the fungus or even the virus will move from the meninges into the nervous tissue itself. So because of the close association of the brain and spinal cord, infection of any of the structures of the central nervous system may involve one of the others. Amoebas can actually cause meningoencephalitis, and we've already mentioned Naegleria fowleri as the brain-eating amoeba and its cousin Acantha amoeba, both of these found in fresh water. Naegleria fowleri are usually small, kind of flash-shaped amoeba that moves by a single pseudopod. And it actually comes in three primary shapes. And this is the most common shape that we see free-floating in water. They can form rounded, thick-walled uninucleated cysts that are resistant to temperature extremes and even mild chlorination. And infections, primarily in the U.S., have been reported in people who have been swimming in warm, natural bodies of fresh water. And it's just not the swimming, you actually have to snort the water up your nose. And this usually has to be pretty forceful. So the amoebas are forced into the nasal passages and then actually will crawl through the cribriform plate of the ethmoid bone, actually following the olfactory nerves to enter into the cranial vault. It enters into the subarachnoid space, causing primary amoebic meningoencephalopathy, encephalitis. Usually will cause rapid, massive destruction of the brain and spinal tissue. And cases, fortunately, are very, very rare. But the disease advances so rapidly that treatment is usually futile, and this carries a 99.9% fatality rate. Only 1 in 128 known cases in the United States has survived, and that was actually with severe brain damage. So this is just the pathway. So getting the water up into the nasal passages. And again, usually this is a pretty forceful injection of the water. But the amoeba will attach then to the olfactory nerves and simply follow the pathway through the cribiform plate here, and then follow along the olfactory bulb into the brain and eventually even the spinal cord if the person lives that long. Acantha amoeba is a large amoeboid trophozoite that actually usually has kind of these spiny pseudopods that we see, and it actually will form a double-walled cyst within tissues. It will actually invade broken skin, the conjunctiva, the lungs, and even the urogenital epithelium, and this will cause a granulomatous amoebic meningoencephalopathy. The course of this infection is usually lengthier than with Naegleria, but again, survival rates are not good. Only about a 2 to 3% survival rate, and that is usually with brain damage. So in chapter 19, this just compares Naegleria fowleri with the Acantha amoeba. Acute encephalitis almost are always caused by viral infections. Signs and symptoms include behavioral changes or confusion in the patient, sometimes the lack of the ability to stand or having ataxic gaits, decreased consciousness and or seizures, symptoms of meningitis, and oftentimes we use acyclovir, one of our workhorses of antiviral therapy, to treat these encephalitises. The arboviruses are actually transmitted by arthropod vectors. Arboviruses are found everywhere in the world, but tend to be clustered in the tropic and subtropical regions. We do see periodic epidemics, however, in temperate zones like where we live. Most vectors feed on the blood of hosts, so this could be transmitted by mosquitoes, ticks, fleas, even lice. Peak incidence usually occurs during late spring and in early fall. Warm-blooded hosts maintain the infection during the cold and dry season, and millions of individuals are infected every year and thousands actually die. There really is no satisfactory treatment for most aboviral encephalitis, and so oftentimes patients are just treated symptomatically. Now, West Nile virus. This one's gotten a lot of press in the last few years. West Nile virus has actually been around for a long time. It is a close relative of a virus known as the St. Louis encephalitis virus, which is also related to the Eastern and Western equine encephalitis viruses and the Venezuelan equine encephalitis virus. This actually emerged for the first time in a human patient in 1999, but we actually saw a case of West Nile virus in a horse in 1996, so we knew it was here by that point. The CDC reported in 2008 that 1% of the U.S. population had evidence of a past or present infection. The seroprevalence in Egypt, where this was discovered in 1937, is 40%. Many people actually get West Nile encephalitis and never know that they had it. Their immune system clears it fast enough. It usually doesn't cause a lot of problems. But this can actually kill, especially in the very young, the very old, and immune-compromised patients. The herpes simplex virus. Herpes simplex type 1 and 2 cause encephalitis in newborns born to the human simplex virus positive mothers oftentimes. The virus is disseminated within the brain tissue and spinal cord, and the prognosis of these newborns is usually very poor. Older children and adults over 50 can also be susceptible. Most of the encephalitises are caused by herpes simplex type 1, and this represents a reactivation of the dormant herpes simplex virus 1 from the trigeminal ganglia. Subacute encephalitis symptoms take longer to show up and are usually less striking, and several things can actually cause these subacute encephalitises. For example, Toxoplasma gondii, persistent measles infections, and even prion diseases. Toxoplasma gondii is a protozoan found worldwide. It's estimated that the majority of the world's population is affected at some time or the other in their lives by Toxoplasma gondii. The vast majority of people that actually get this protozoan parasite, however, will clear it from the digestive tract or other body areas through the immune system and not even know that they had it. However, infection in the fetus and immunodeficient individuals is oftentimes fatal. People with a history of toxoplasma are more likely to display thrill-seeking behaviors and have slower reaction times, even though some studies have shown that this is actually not to be true. Toxoplasma gondii is a flagellated parasite, and it can attack at least 200 species of birds and mammals. The primary reservoir in nature, however, of toxoplasma is felines, both wild and domesticated. Again, most people that have Toxoplasma gondii infections are usually asymptomatic, but we may see some people that have sore throat, lymph node enlargement, low-grade fever, and then they get over it. A chronic or subacute encephalitis can be seen in patients oftentimes that are immune suppressed. Now, the problem with Toxoplasma gondii, besides in immune-compromised patients, is during pregnancy. There's a 33% chance of the mother transmitting the parasite to the fetus through the placental membrane. And congenital infections occur usually in the first or second trimester. This can result in stillborns. It will cause liver and spleen enlargements in the fetus, can cause liver failure in the fetus, and hydrocephalus. Even convulsions in the fetus in utero. They can damage the retina and cause blindness. And so the big thing has always been that pregnant women should not be around cats during pregnancy. Well, this doesn't mean you have to get rid of your cat if you're pregnant. What we'll see is that the sexual phase of the toxoplasma will be shed in the stool of the cat. Then this undergoes the asexual phase and actually result in the oocytes or eggs. The female then can pick it up and then develop the infection and then pass those on to the fetus where it could cause anything from blindness to stillborn. However, the mother has to come in contact with the oocytes, and usually these asexual phase are still occurring within the fecal material. So as long as mom is not eating the Tootsie Rolls out of the litter box, she's probably going to be fine. And if she's had the cat for any length of time and the cat did have toxoplasmosis, then she's probably already had toxoplasma, and it probably isn't going to cause any problem. However, we do know that the oocytes can encyst in muscle tissues of cattle, sheep, and poultry, and so we can actually sometimes see transmission through the eating of undercooked meat as well. But you don't actually have to get rid of your cat. Just simply don't eat the Tootsie Rolls. Wear gloves if you have to change the litter box or have somebody else change the litter box, and under no circumstances kiss your cat on the butt. Now, prions. We said prions were actually proteinaceous structures, proteins, that acted like viruses. They contain no genetic material because they're simply a protein. And they cause transmissible spongiform encephalopathies, basically destroying brain tissue, leaving the brain looking like Swiss cheese. Creutzfeldt-Jakob disease is the primary form seen in humans. We also see Gerstmann-Strutzel-Schnickler disease in humans. The old name for what we now know as Creutzfeldt-Jakob is actually Kuru, and there may be actually some differences in these three, but they're all prion diseases. Kuru was actually recognized in indigenous populations in the Southeast Asia and Pacific regions in those populations as early as the 1850s. Fatal familial insomnia is another form of disease that prion diseases can cause, and this is actually just the fact that these individuals never sleep. And I think that would be one of the worst ways in the world to actually die, is just because you cannot sleep. We also know that prion diseases causes scrapie in sheep and goats, and bovine spongiform encephalopathy in cattle, and perhaps grass equine sickness in horses. And these all may be a related type disease. We're not exactly sure, but we do know they're all prion diseases. There is a normal protein found within brain tissue called PRPC that is transformed into an abnormal protein called PRPSC, which is the prion protein. This altered protein can spontaneously convert other PRPCs into the abnormal form of the protein. And this will then cause accumulation of these abnormal proteins within neurons and causing plaques, and this will cause the cells to die, and this results in the spongiform damage within the brain itself. This can cause disease when transferred to a new host. So really you have to actually ingest the infected tissue, which is going to be nervous tissue. However, you could see transmission of this abnormal protein on the surface of contaminated instruments or potentially even infected meat, because does meat have some nervous tissue? Yeah, it has the nerves themselves. Even though this may not be a major transmission, it may be the fact that people do eat brains and spinal cord, and this may be the primary way that this is transmitted. So here's a normal looking brain. Here's some neurons in there. And this is classic CJD. So we just have these holes where the neurons are just gone. Kuru, very similar. And this is scrapie in the sheep. So again, very similar amongst all these different diseases caused by prions. Now I want to talk a little bit about rabies. Rabies is a slow progressive zoonotic disease characterized by fatal encephalitis. There are two forms of rabies. The furious form of rabies is where the patient is agitated, they become disoriented, having seizures, and oftentimes just muscle twitching. They oftentimes also have hydrophobia, and even though they are very, very thirsty, they don't want to drink, and yet they are foaming at the mouth, and that's what the hydrophobia is. Fortunately, the furious form is actually the more or the less common form. The dumb form, if you gotta have it, I guess, the patient becomes paralyzed, disoriented. They typically will slip into a coma uh, very quickly. And so both forms progress to the coma phase, and eventually death will ensue. Death results typically from cardiac or respiratory arrest due to the severe encephalitis infecting the lower parts of the brain. So this is kind of the classic furious form in an animal of rabies. And, some of you probably as kids maybe watched Old Yeller or some of those movies, and that was the furious form. However, this is usually the classic presentation that we see. The animal is over in the corner. They're kind of stuporous. They don't want to move. They can be salivating, but usually not the hydrophobia. And they just look awful. And this is usually the more common form that we see, both in animals and in humans. The reservoir of rabies is any wild mammal. Canines, skunks, raccoons, badgers, cats, bats, the list goes on and on. Any warm-blooded mammal can carry rabies. Spread to domesticated animals and humans are oftentimes through the bites, scratches, or inhalation of saliva droplets from the wild mammals. It's estimated that between 3,500 to 500,000 human cases per year of rabies occur worldwide. In the U.S., this is around 6,000 to 7,000 animal cases per year. And in 2004, transmission of rabies was actually seen through donated organs and tissues in a case. In our area here in southwest Missouri, this is the classic wild reservoir. Again, even though any wild mammal can carry it, skunks actually can carry rabies without showing clinical signs for a very long period of time. So, lots of reasons not to play with a skunk, but rabies is another one here. And this is kind of the distribution of the major animal reservoirs. So again, in the Midwest region, it's primarily the skunk, and there's a couple of different species of skunks that carry it. Out here in Alaska, actually, it is the fox, and in Arizona and central parts of Texas. We also will see that coyotes can be a carrier, primarily down in the southern part of Texas and into Old Mexico. In the eastern part of the United States, stay away from the masked bandits. It's the raccoon that tends to carry rabies as the reservoir. And of course, bats are actually seen throughout the country as a reservoir. There was a gentleman from Houston, Missouri several years ago that was actually bitten by a rabid bat, did not seek treatment, and actually died of rabies here in southwest Missouri. So prevention of rabies, if we know that you have been bitten by a potential rabid animal, we will start post-exposure prophylaxis. And these usually will include vaccination and treatment with human rabies immunoglobulin. Now, this used to be a series of 13 to 15 shots that were given intraperitoneally into the abdominal cavity. Now it's actually only 3 intramuscular shots given primarily in the muscles of the legs or arms. Also, vaccination of domesticated animals, and this includes dogs, cats, even ferrets and rabbits, veterinarians, animal handlers, any laboratory personnel that handle animals, or travelers to areas where rabies may be more endemic. Vaccine is incorporated into bait to oftentimes actually inoculate wild animals. They're doing a massive project in Africa right now in trying to actually vaccinate both the domesticated dogs as well as the wild dogs. The rabies vaccine is actually available for human use. I've been vaccinated for rabies. This is not the same vaccine that we give to our animals. But all of these rabies vaccines were actually based upon Pasteur's vaccine that he used back in the 1800s. Now, poliovirus. This causes an acute enteroviral infection of the spinal cord. This causes neuromuscular paralysis that tends to be chronic. Signs and symptoms of the virus is fever, headache, nausea, sore throat, and muscle pain, myalgia. Can be neurotrophic. It infiltrates the anterior horn of the motor neurons of the spinal cord, and that's why we get the myalgia and muscle paralysis. It can also attack the spinal ganglia, cranial nerves, and even motor nuclei within the brain itself. The sequelae of polio is typically paralytic diseases. Varying degrees of flaccid paralysis of the muscles of the leg, abdomen, back, intercostal muscles, diaphragm, pectoral girdle, and bladder are actually seen. And so think about this, your intercostals and diaphragm. This is going to cause problems with respiration. Bulbar poliomyelitis infects the brainstem, medulla, and the cranial nerves. And the post-polio syndrome, we typically will see a progressing muscle deterioration in 25 to 50% of patients, sometimes even decades after the initial infection. Prevention of polio. Humans are the only known reservoir for poliovirus. We do not see them in other animals. Vaccination as early in life as possible. It should begin with 4 doses starting around age 2 months of age. The IPV vaccine was developed by Salk in 1954 and was used in the United States for many, many years. The oral poliovirus was developed by Sabine in the 1960s, and both the intramuscular and oral vaccines have both been used. The last naturally occurring case of polio was actually seen in 1976 in the United States. However, we have had an outbreak in the last few years of a polio-like disease in some children, especially in the western United States. We're not exactly sure what this is, and studies are still ongoing. And this is just showing the oral vaccine. So in 1988, most of the polio had been eradicated from the northern hemisphere in North America, Canada, Greenland, and parts of South America and Australia, and most of the industrialized nations of Europe. But we still saw a lot of polio in northern South America, in Central America, in Africa, India, and Asia. So this was 1988. This is the year 2012, and it is an estimate, but now we only basically see polio in some very isolated areas in northwestern India and parts of Africa. The goal of the World Health Organization is to eradicate polio around the world by the year 2025. But we have seen some areas that are breaking out again, and that includes some of the island nations over here in the Western Pacific, as well as Southeast Asia, and again, those polio-like cases that we saw up here in the western part of the United States. Are they truly polio? We're just still not sure at this point. And I've shown you this picture before, but these are actually some children from an island nation known as Sri Lanka, where polio is still an endemic disease, unfortunately. And these children have had polio, they've survived, but they will have a continuation of the problems with the muscles in the limbs. This little boy is never going to stand up and walk again. Now, I said that this actually affects the muscles of respiration, and this was a picture from the 1950s, I believe it was. And each of these machines, and you'll notice that there's children in them, and these were known as iron lungs. And these were assisting machines. They were basically an external respirator that helped these children breathe because they simply could not breathe on their own because of the weakness of the respiratory muscles. Now, many of the children recovered enough to actually leave the iron lungs, but there was a case of a gentleman who actually lived almost 60 years inside an iron lung. And for me, I'm thinking quality of life here. I'm just not quite sure about that. Tetanus, caused by the bacterium Clostridium tetani, which is a anaerobic bacterium. It's a common resident of soil and GI tracts. In the soil, it exists as an endospore. It's a gram-positive endospore-forming rod. Endospores are only produced under anaerobic conditions. Tetanus actually causes tetanospasmin, which is a toxin that binds to target sites on peripheral motor neurons on the spinal cord, brain, and sympathetic nervous system, causing sustained contraction within the skeletal muscle. It blocks the inhibition of muscle contraction, causing the muscles to contract uncontrollably, resulting in spastic paralysis. And eventually, the tetanospasmin will actually affect cardiac muscle. Death results primarily from paralysis of respiratory muscle and respiratory arrest, but may also result from stoppage of the heart. This is kind of the classic technospasms that we see, hyperextension of the neck, hyperextension of the back. We'll see flexor muscles here in the upper limb. The lower limbs tend to be in full extension. Prevention of tetanus. This is really one of the world's most preventable diseases. Vaccination with the tetanus toxoid, usually in combination with diphtheria and pertussis toxoids, is one of the most common vaccines that we use today. Vaccines are given to children under the age of 7, and these boosters should be given every 10 years thereafter, or if you have an injury. Toxoid should also be given to injured patients who have never been immunized or have not completed the series or whose last booster was received more than 10 years previously. The vaccine can also be given with passive TIG. Now, botulism is intoxication caused by an exotoxin produced by Clostridium botulinum, and this is usually associated with eating poorly preserved foods. Usually we see 10 to 30 outbreaks per year in the United States, and this is the foodborne botulism that we sometimes hear about. However, this can be seen a lot of times in infant foods, and this can cause botulism in the infant. We can even see these anaerobic bacteria being injected into wounds, causing wound botulism. Clostridium botulinum produces the botulism toxin, and this travels from the bloodstream to the neuromuscular junction of skeletal muscles. It prevents or blocks the release of acetylcholine, which is the neurotransmitter of the neuromuscular junction, resulting in flaccid paralysis. So unlike tetanus that causes contraction, botulism prevents contraction. Botulism toxin itself has been used to treat uncontrolled muscle spasms, migraine headaches, and other conditions. And of course, we also know that it has been used cosmetically. But you have to understand, this is a toxin. So botulism does one of two things, and we're not quite sure exactly, but it may just simply block the acetylcholine release completely or block the receptors of the acetylcholine. Most thoughts actually say that botulism toxin will actually block the release of acetylcholine, therefore preventing, again, contraction of the muscle to occur. Trypanosoma brucei, causing African sleeping sickness or sleepiness sickness. This is a hemoflagellate. It is actually a protozoan parasite. It lives in the bloodstream and in other tissues of the human host. And this is what the organism looks like here in the bloodstream. Trypanosomiasis affects millions of individuals in over 36 countries, primarily in Africa. It is transmitted by a specific host or specific vector known as the tsetse fly, and that's this little fly right here. It's actually a fairly good sized fly. It can actually measure a half an inch to almost an inch long. Trypanosoma brucei gambinensis and Brucei rhodesiensis are the two most common strains that we see causing African sleeping sickness. Signs and symptoms of sleeping sickness include intermediate fever, enlargement of the spleen, swollen lymph nodes all over, and typically joint pain. We can also see personality and behavioral changes, oftentimes with the person becoming stuporous. They actually will have lassitude, which basically means they're just kind of sitting there. Sleep disturbances may not be or may be unable to sleep, and therefore be uncontrolled sleepiness during the day. They can also exhibit muscle tremors, a shuffling type gait, slurred speech, seizures, and even localized paralysis. Death usually results from coma, secondary infections, and heart damage. So trypanosoma seen again primarily in sub-Saharan equatorial Africa because again, that's where the tsetse fly is actually located. So this is just the table summing up the microorganism causing disease in the nervous system. And again, these pages may not match your text exactly, but they will be close if you want to read more about them. And so that's it for the first disease PowerPoint, and we'll continue on in the next.